And I think in many ways, that is an interesting segue for this conversation as well. I think that it is, it's a sign, right? It's a sign of sometimes sorry, can you hear me well?
Very well.
All right. So there was a duplication at my end, which I have fixed. And I think, to repeat myself, that is an interesting segue to this conversation, because sometimes you expect things to work the way that they ought to, or the way that you have planned. Um, that is something about families too. We have an image of families in our mind, just like at Caregiver Saathi, we had an image of what the live stream might look like. But sometimes things happen and there are technical glitches, and they don't necessarily work the way that we had imagined them to. And you need an intervention, and counseling can perhaps be that very interesting intervention to help us make things work. We were having a detailed conversation with the two very eminent speakers that I have today about the power of counseling for family caregivers. And we will have this conversation today. I am so excited about it. I am also excited because these two lovely women have become my dear friends. So it's a little bit like Friday evening chai or coffee with two friends, and a conversation about an issue that requires deep attention. So a very warm welcome to each one of you to our webinar, Compassionate Caring.
Thank you. A bit of chit chat, but we hope to meet for chat.
Correct.
Over chai.
Correct. And guess what? This is our 31st webinar. And it has been a trying year for each one of us. And I am delighted to see many familiar faces who have encouraged and supported us through this endeavor. We do work very hard in the background to try and make these webinars meaningful, pertinent to the purpose and the reason that we exist as Caregiver Saathi. I will take a few minutes to tell you what Caregiver Saathi is. And for some of you who have heard this many times, just bear with me and maybe make some side notes and tell me how I can do this better. So family caregivers of those who are navigating terminal illnesses, chronic or any other life-limiting conditions have unique. Caregiver Saathi supports them during their caregiving journeys and beyond. We are trying to create an ecosystem of well-being and healing for the caregiver. In 2018, when we started off on this journey, we thought we will be looking at conditions that are incurable, and that we will be looking at a population that was perhaps in the region of 16 to 19 crores in India. But COVID has turned everything on its head. COVID has actually made that population much larger. Each one of us is a family caregiver navigating an unreliable condition. So it doesn't necessarily fall in the category of incurable, but it is certainly something that is unpredictable. And it requires attention because each one of us is a caregiver. What does it mean to have an environment of well-being? I personally, passionately believe that if we have choice, then we feel empowered. If caregivers have a choice, then they will feel empowered. And we need to look at all those things that make caregivers choiceless. How can we provide them choice with everything that they do will be an act of empowering for them to feel empowered, and we would have met our purpose. So how can the caregiver and the care receiver lead full lives? is a question we are out to solve. How do we do this? Technology is the reason that we can have this conversation here today, and many of you can join us at different points in time. So technology does enable our system, but we do believe in human touch and human connection. And we build this human touch and human connection through learning or awareness programs, through a helpline, through healing circles or support groups, through communication, relentless everyday communication through multiple media. Social media definitely empowers that. Access to reliable and relevant information. This one thing has become so important. Even as I speak right now, for access to reliable, trustworthy, verified resources for COVID has been such a big challenge. I would like to tell you at Caregiver Saathi, we have more than 700 registered volunteers, of which more than 300 are actively working 24/7 to verify medical resources that each one of us can access. And these are some gaps in our healthcare system. So there is a tech-enabled support, both in terms of an app and a platform. The resources that we have built so far include that platform or an app, which is constantly evolving. I would encourage you to look at our website, caregiversaathi.co.in, and sign up for some of the programs, which are learning programs, which are mostly online these days. There is an app for caregivers. One of the most common refrains of caregivers is, who has the time? I am busy and I don't have the mental bandwidth. So the Caregiver Saathi app is designed to help caregivers create time and build both their physical and emotional infrastructure. So if you download that app, you can access some tools that can help you create the time for replenishing yourself, taking time out for yourself, and accessing things like this webinar. There is a community of caregivers, people who have gone through their caregiving journey, people who are experts, people who might want to support others who might be actively in their caregiving journey. So join our community on Facebook, WhatsApp, and some of these programs that you can access. The most powerful thing we believe over the years has been the power of telling stories. We have held on to a large number of beliefs, and the very essence of our civilization is also storytelling. So we believe that the stories of caregivers have hitherto been hidden or not accessed by many people. Caregivers are really the invisible warriors, or warriors who have a gentle way of healing and providing support to others. We publish caregiver stories in two formats. One is a video, and the second is a podcast. For those of you who want to tell your story but wish to remain anonymous, can do that through our podcast. And those of you who would like to talk to another person and tell your story on video, then every Wednesday, follow us on YouTube and Facebook, and you will hear other stories and be encouraged and inspired, and hopefully will want to tell your story too. Storytelling is healing, not just for the storyteller, but for the listener as well. Compassionate Caring is the expert-led programs. This webinar is one such in which experts come in and give a perspective. Compassion is not just for the patient, but compassion for oneself. And we believe there deserves to be a healthy balance between care and compassion for both the caregiver and the care receiver. And this balance can often be hard to strike. So constant interventions, learning new ways, being able to see the situation differently can be helpful, which is why these webinars. Coaching is a powerful method and tool for caregivers too, although caregivers need coaching to build unique skills. None of us plans to be a caregiver. It happens and lands in our lap one fine day. So caregiver coaching can help you actually navigate and build some skills that you may have not thought might be relevant for your emotional mastery or building resilience. Family counseling, and that will be also a big part of the conversation today, is something that we offer because illness and sometimes challenging long-term illnesses can have an impact on not just the whole family, but sometimes generations. Family counseling, therefore, plays a very important role, and there need not be any taboo around it. I don't think there is any family that is from the television serials or the films that paint a very rosy picture. Each family has its challenges, uniqueness, and dysfunctionality, and it is okay to work with that. Finally, a volunteer-based respite care program, which is active, like I told you. This is something that we are building on, so watch this space to hear more about it. How can you contribute? There are many ways in which you can contribute. Pick the one that works for you. But one of the things that I always say is that the healing circles or support group or counseling is not something that we as well-wishers should advise caregivers. Always make that choice for yourself. So if you are a healthy well-wisher, don't just tell the caregiver you should go to the professional. Maybe first you go to the professional and then be a companion to the caregiver and walk along with them, and that might be a more effective way. That said, very quickly and a repetition, there are 7 elements of well-being. At the very core is physiological, psychological, and spiritual well-being. This is for the individual, and in terms of our interface with the world is social, financial, legal, life and work purpose, and our very unique creative expression. As you can imagine, family counseling and the topic for today will focus on the social well-being aspect. The family is a unit of our society. So our social well-being depends on the health of the family and the psychological well-being. Stress is caused by an imbalance in the well-being, and unaddressed chronic stress can lead to mental health issues, even if it is about our social well-being. So it is important to build resilience through practices of the mind, body, and soul. And with that, the admin announcement for today is, as always, we will have a conversation, and there are broadly 3 parts. You're welcome to ask your questions. We urge you to give us feedback and participate as much as possible. We are live on YouTube, and we will post this video on Facebook as well. However, we will not post our conversation. So that section will not be available for public consumption. These insights and your participation help us make our forthcoming programs better. So your input is really valuable. Please do participate. With that said, welcome to my friend and an eminent palliative care speaker, someone who has impressed many people. I must let you in into a secret. I got an email from someone in UK who wanted to do a film and said, I want to reach out to Dr. Rajam Iyer, who I think is associated with your organization. I have to say, I did get a lot of joy from that interaction. And I'm sure that is just one example of who she is. Welcome,
Thank you,
Rajam.
Bhavana.
Welcome.
Thank you.
And Vandana. Vandana, in addition to everything you see on my screen, as a fighter, survivor, compassionate person, is also an ambassador of Caregiver Saathi. And we are delighted to have her here with her enthusiastic energy. She's the one, she's constantly pushing and pulling and making sure that Caregiver Saathi is, pushing the envelope on a daily basis. So like I said before, this is a conversation between 3 friends, and we are delighted to have you watch this conversation. Welcome, Vandana.
Thank you. Thank you, Bhavna. It is a pleasure being here with you and absolute pleasure being here on the same forum with Rajam.
All
Honored.
right. Okay. So, the topic of the day, and Dr. Rajam, let's start with your opening remarks about the significance of family counseling. How do you see it? And how would you start this conversation?
So, Bhavna, I think it also starts with the fact, like you said, every family is different, every family is distinct. You need not have a person with a chronic or stroke, acute, or COVID to actually feel or sense when you're talking to a family with, to sense that they need some help. So recently, I was just talking to a friend's set of parents, and it seemed very obvious that during the COVID pandemic, the elderly couple living alone had so much of interaction amongst themselves and were so exasperated with each other's company, with each other's comments, with each other's finicky, despite the fact that they were married for 50 plus years. So I think you realize at the end of that conversation that both are at their wits end of how to live under the same roof, and they're perfectly normal people. Yes, they are 75 plus. Yes, they are elderly, their children are away, so once in a while I do keep in touch with them. So when you realize, I think all families, especially during the COVID times, have come under a very significant stress. It might just be the daily rut of getting up, making tea, lunch, breakfast, cooking, cleaning. So my whole point here is that you really don't need an illness. I think illness really sets it off, whether it's acute or chronic. I think just being together under one roof, however small or big that flat is, it really has put families, relationships, and equations under a lot of stress. And I think I experienced that myself, even though I don't have a large family or many people to please, but it's just the age group and the generation. And
Yeah.
it does get stressful when you are also a professional caregiver to your patients, and then your role changes when you become a family caregiver. So I really don't think an illness is necessary for family counseling. An illness, there is an illness, whether it's acute or chronic, then family counseling becomes even more essential. So I think even normal people, we really can see the stress during the pandemic and the lockdown, and just the interaction 24/7.
Yeah. I had one person who said that, and fairly early on, so today might be very difficult, but fairly early on said, you know what, Bhavna, I love my family, but bus, ho gaya.
Bas.
You know, itna hi. I, I also need to kind of step out. So yeah, it's a human thing to, 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 to feel the tension. Over to you, Vandana. How would you open this conversation today?
So, carrying on from where Rajam left, I think what she covered a lot. I would also add to this that the uncertainty of when it's going to end is increasing the stress and the anxiety in people. The inability to step out, the inability to interact. Human beings are social by nature. Just seeing, like you said, bahut ho gaya, seeing just those 4 or 5 people in the house, you practically by the end of the day at each. So you're at each other's throat. So the inability to be human in terms of going out, meeting with each other, socializing, is playing a lot on their minds, and that is increasing the stress levels, and the stress levels in turn, if they're not corrected in time, are increasing, are leading to panic attacks and anxiety.
I do think that I was talking to another friend, and when 4 or 5 people are in the family infected and probably simultaneously need to be isolated, the sheer physical work pressure is of an inordinate volume, and of course the anxiety of the illness and getting well as well. So even after people are recovering, there is not just the physical impact of the condition, but the fact that relationships are frayed, and you have probably seen the harder or the the worst side of each other more often than not. So, what in your experience, Dr. Rajam, has been people's outlook to something when you suggest, and you're an expert, so people come to you. And if you were to suggest, listen, you need to go for family counseling, what do you find is the uptake for that advice?
So, for families suffering from COVID, it actually starts. I mean, it might not be defined under the category of counseling, but when they get in touch with somebody like me, a pulmonologist, I think the person who is isolated, to the person who is in the hospital, to the family who is probably alone at home, quarantined, there is already counseling started from a different levels. I mean, you are the mediator between what's happening in the hospital to people at home, or for a person who's isolated, you are actually sitting and watching all his parameters that he or she sends every 4 hours, and then you say, don't worry, test this, drink this. So there is a different kind of a professional counseling already going on. What actually one has noticed is when they're in the thick of things, they really just want to get hold of a doctor. So in
Mm,
such desperate situations, we've had calls not from the same city, because now everything is teleconsulting. We've had people who've desperately reached out, friends or families, friend, saying, please get us a pulmonologist. Everybody seems to be busy. For example, last week I had 3 or 4 calls from Bangalore, because the Bangalore pulmonologists, I'm sure, are battling the disease in the hospitals, in the ICUs. And since
mm,
Bombay numbers are a little bit better,
mm,
and so that, that kind of desperation. So when they're in the thick of things, I think it's the professional help they need, what medications, what blood tests, when to do CT, etc. It is, I think the main counseling comes once either the family member is critical in the hospital, and it then goes on and on and on. It's not just the 2 weeks. There are people who have been in the hospital, in the wards, in the ICU for more than a month. That can get really, really difficult. Or
yeah,
I think even more difficult is when people lose their loved ones, because
yeah.
COVID is an illness which comes out of the blue. It's an acute illness. Everybody has lived in the panic and fear of, oh gosh, what if I get it?
Yeah,
And two, when they really do and things go south, it really becomes difficult. So at this
yeah.
point, I would really like to share a very heart-wrenching story of my own MD teacher who couldn't get a bed for her 39-year-old nephew, and she struggled 12 hours till he really was in a bad shape, and then eventually didn't make it. And
Oh my
5 days
God.
after his passing away, her mother died in the shock of losing her only grandson at 39. And this happens to a doctor in an urban city in the 21st century India. This is such a sense of helplessness. And I can see that she's withdrawn into a shell. This is an educated postgraduate MD teacher heading a department for 30 plus years. So if
Mm,
this can happen to somebody like her, imagine what is going on in our country, and how the level of suffering that people at all status and all socioeconomic levels are going through. I mean, I
mm,
can't bear the amount of trauma that families have gone through, losing loved ones because of lack of beds, lack of oxygen, lack of ventilators. We had the time last year at this time, we probably should, we could have still pardoned ourselves. But
yeah.
1 year later, to lose so many of us for such things is difficult. So I think that is where the grief counseling, and as it is with COVID, there is no farewell, there is no final hug, there is no
Mm,
bereavement process where people come and share your grief. So I think this is where the focus will have to be on, because I think when they're in acute phase of COVID, the focus is more on professional counseling and, make me better. Will I get better? Are my parameters right? But I think it's these
mm,
difficult situations where you can't be bedside, patient is not doing well. The
mm,
line of communication has to be established between what's happening in the hospital and then the loss. So I think it's very, very important to focus on those families who have
mm,
had and gone through these things. And I think it's important to be in touch with them. At some point, they will reach out to you. So I think being there is important, via SMS without being intrusive, or a WhatsApp call, or just a missed call, to know that you're there even if, I mean, you might not be able to say the right things which will soothe them. I don't even think they want to move on. I think they just want to be heard or just want to be. And I think just being there for them is important at this time. So I think recognizing those difficult things, because the second wave, Bhavna, has actually hit me also, is that it really could have been any of us. This could have
Exactly.
happened to any of us. So, it's not the survivor's guilt. It's just that, gosh, I mean,
Yeah.
this is like somebody I know, it's like too close to home.
Yeah. Yeah.
That really hits below the belt.
That is true. That is true. In my conversation, Vandana, you were speaking about something called COVID psychosis. What is that? Yeah.
So I just want to add a bit to what Dr. Rajam said. The anxiety comes in the moment you are diagnosed,
Yeah.
because, like she said, access to doctors is very difficult with so many number of patient number is so high. Somewhere in their mind they start fretting that a hospital bed, if they deteriorate, they will not be able to get admission into the hospital even if they are stable. So a person who has a stable disease, because of these factors, starts deteriorating mentally. So
Mm,
that is what I wanted to add. The fear of not being attended to by a doctor or not getting admission in a hospital is really affecting their mental health. And now to about COVID psychosis. Like Dr. Rajam, you and I we were discussing yesterday, there is something known as post-COVID psychosis, but I also feel there is a pre-COVID psychosis.
mm,
The fear of, like I said, just the fear of the disease is so big, Bhavna, that
mm,
people are, anticipatory anxiety. I mean, I don't know if there's a word coined as anticipatory anxiety, but this is what I have seen in COVID. Why? Because first of all, it's a communicable disease.
mm.
Second is, because of, how easily it is being transmitted. You don't know how you get it, how you can, pass it on to others. And also, as Dr. Rajam was saying, if you get it, you are quarantined. What happens to the rest of the family? If
Yeah.
your kids get it and you
Yeah.
are okay, then what
Yeah.
happens to them?
Yeah.
If one of your family members is admitted, and God forbid, if they don't come back from the hospital, so
Yeah.
I get
Yeah.
goosebumps thinking of it. And yeah, so this is pre-COVID psychosis. And post-COVID psychosis, Bhavna, is so big. I can't even tell people about how big it is. I've been counseling patients, caregivers who have recovered from COVID, and it is going to be a pandemic at a different level when things settle down.
Yeah.
I'm going to talk about a case of a young, counselee. He reached out to me, and the day he called me, his family called me, via, because they realized he wasn't doing well. I got into a counseling session with him. The first thing he did was he started crying. He just broke down. He says, I don't know what is happening to me. I am the primary caregiver. I have daughters. I have old parents. I have a wife to take care of, a shop to run, but I just can't seem to get hold of myself. Unfortunately, COVID is affecting people mentally, which is a reality that all of us need to face. So fortunately with him, we did a couple of about 3-4 sessions, and today he is good to go. So post COVID psychosis is huge. Counseling will help, but there may be a need for a psychiatric intervention also.
From case to case. And when I hear you describe this particular case, I actually feel good that if there were tears, I think tears are good solvents. Frankly, I worry about all of us who, I mean, I can speak for myself for certain. I have a problem tearing up. Or at best, I will tear up to that extent, but I can't break down. I wish I could, you know. I really wish that I could express myself through tears, because I think the 1 or 2 times that I have, if I have, then that has been cathartic. That kind of gives you the release, and there is no shame in that breakdown. um, it's actually better than holding up, because this bravado of holding up can actually be flawed, right? What do you say to that, Rajam?
So I'm the exact opposite. I don't take much at all to tear up. I'm the exact opposite. I can
Mm,
cry with patients, I can cry with caregivers, and sometimes I think that's a bit much. But
mm,
it's very easy for me to cry. But I also think that yes, counseling helps. But I feel what I feel about when Vandana told about the fear and the panic. Now, as a pulmonologist, I think I need to sort out a few of these things. There's just too much information out in the public, and too much of this information is probably not right. And
mm,
therefore, I feel we must reiterate the fact that yes, corona has is a pandemic. There is no doubt about it. It is a respiratory virus, so it's easily transmissible. It is a novel virus. That's why there is a huge immune response from the body. What I really urge to for people to remember here is, as a pulmonologist, since we have now been wise only for a year, this is my wisdom from the past year, that please remember, in a country of 1.3 plus billion population, please remember that only 5 to 7% of patients have had the severe illness. The problem with our country is the population. So, because 5 to 7% of 1.3 billion is a lot, obviously a lot is affected. But please remember, majority of patients still have mild and moderate illness. A lot of patients have recovered with just home quarantine. We please need to remember that all those people who are RT-PCR positive need not get a CT done. Please don't leave your homes and rush to get a CT done. CT scan is required only and only your all the symptoms. Your RT-PCR is negative on the seventh day, and for diagnosis, you need a CT scan. You don't need a CT scan when you are RT-PCR positive. We already know the diagnosis. Unnecessary blood investigations and monitoring all the inflammatory parameters is another thing that is completely making patients and caregivers bonkers. Do not do them if the patient is stable and all the vitals are normal. Connect yours to a doctor. It could even be a family physician. Send him the vital parameters. Let him decide when your oxygen levels are falling and when the alarm bells need to ring. Do not do blood tests unnecessary. We do not treat reports, we treat humans. And that is the biggest thing we need to push, that we really need. If a person is fine, he's eating, drinking, able to walk, isolated in a room, yes, he needs some counseling, but he doesn't need to panic. He needs to be reassured, all this is fine, continue to doing what you are. All the medication. Sorry, Bhavna, you wanted to say something?
no, yeah, let you finish, then I'll join you.
All the medications that we tried last year are out of the window this year. There is no role for antibiotics in a viral infection. There is no role for HCQ, ivermectin. There is no evidence. So do not make the pharma companies unnecessarily rich by stocking Fabiflu, by stocking these things. It's not needed. We really don't need these things. And another very important fact that I would like to say is, do not repeat RT-PCR at the end of your 14 days. It may be positive, but it is not transmissible. It is not infective. And I feel sorry when the celebrities keep saying, I have become RT-PCR negative.
Absolutely.
And that's the reason why people are forced to do. We already have less resourced kits in this country. Do not waste on repeating, 14th day, 21st day, 28th day. It is not needed. The infectivity of the virus is gone after 10 days.
Well said.
And the last thing, and the most important, if you have had COVID, doesn't mean you will not get it again. So stop being this macho man and going out in public without the mask. That cannot stop. And the final nail, I think, is the vaccine. The only way out of our pandemic is the vaccine. So, elderly, young people, everybody, please get vaccinated. I know it's a shortage, but we can't afford vaccine wastage also. We can't afford vaccine hesitancy also. Please remember that in the last wave, we lost approximately 800 doctors. We did lose some this wave also, but the
Yeah.
numbers are far less because healthcare workers did get vaccinated in Jan and Feb. Also, we have noticed that people with vaccinations are getting milder infections. Of course, it's not a black and white rule. There are people with both vaccinations who are exposed to a lot of the viral load, if they've had to look after elderly parents, etc., who are getting it. But the mortality is less. So at least vaccine will prevent taking you to hospital,
Yeah.
oxygen, and mortality. So you need to get your fundas right before getting panicky. Yes, isolation quarantine is difficult, but please remember that just being COVID positive is not a death sentence, not 1 year into the pandemic. And we really need to pat our scientists that in 2021, given the fact that within 1 year we had the vaccine, which is effective, we really need to be grateful. So please go ahead and take it. And I think because of the 2020 and 2021, we at least could remain connected digitally. अगर ये भी नहीं होता तो सोचो हम क्या करते. So I'm trying to see the plus points, but I know I've had my bad days too. But at least because it was the 21st century, we managed this much. We reached out to
That's
people
right.
virtually.
That's right. That's right. In fact, I have very often wondered about, the black, what's it called? The black plague or the
Oh,
black
black
disease?
fungus.
No,
You
no,
mean the
no.
plague? Oh,
The
The
plague.
bubonic plague.
The
Bubonic
The
plague.
bubonic plague.
How things would have been, so hard at that time, or that was long ago. Let's think about the partition or any war. It must have been similar, right? I was just wondering about some of the stories my grandmother told me, which is they would wait for days, for you don't know whether certain family members will be around or come or and it would have been so hard. So you're absolutely right. I think the attitude of gratitude enables you to have hope. It enables you to take one day at a time, and it enables you to take one step at a time. And that is very important, to stay calm. The reason that I wanted to speak earlier was that there was a fear, or there was a scare that my husband, who had COVID last year, will have again this year, and he belongs to that let's take all the precautions kind of a person, which is a good thing. And I'm the other extreme, which is let's take all the risks. So we are, as you can imagine, quite a firework combination at home. But it was useful to have conversations with both of you in those days to kind of keep your centeredness, be able to appreciate the fears of, a family member, your partner, at the same time, not flow in that. So, Vandana, do you encounter when you do family counseling, family members can be so different from each other, and they might actually be looking in opposite directions. So what is that about? Give us an insight.
So first, I want to thank Dr. Rajam for saying what she did. If people heard doctors well, it would reduce the workload on the counselors so much.
But for that, you need doctors to talk, Vandana.
Yeah, which is very true. So we need more people, more doctors like Dr. Rajam to come up and address the public, because that's where the panic begins.
So the communication skills, I owe it to Dr. Nagesh. A lot of it I've learned from him. So I think if you have that, I can't tell you how important it is to even talk to your maid in the house. It makes such a big difference. And in fact, I got a backhanded compliment from my mother saying, the way you talk to them, I cannot talk. I said, yes, you need to be trained by the right people in communication. So it really does make a difference.
So thank you for that, because, if doctors spoke, the panic is going to come down, right? That's where the panic originates, because they believe in what is being fed to them. The disinformation is the greatest disservice being done to humanity today. That is what my belief is. So, and now coming to family counseling during COVID times, I'm going to quote my family, Bhavana. We are husband, wife, and a daughter, right? Husband is a blue blood Fauji, so for him, wear a mask, go out. I, being a slightly susceptible person, in terms of battling with with few health conditions, I'm a little guarded. And then there's my daughter who says, "Ghar se nahi nikalna hai." So there are three people with three different attitudes dealing with the same situation. So it is very important to prevent clash of ideas at home. It is very important to give each member their space. I cannot, it is not correct for me to encroach in my daughter's space and tell her, because I think like this, so you must think like that. She is her own person. She has the right to think the way she wants to. And it is very important. As a mother, as father, we respect that. Same goes for my husband, and vice versa, for both of them to think about me. So dealing with families during pandemic, it is important that the insecurities of each family members comes from their experience or their fears. And it is okay to let them express their fears. But when I say this, it is also important to speak to them about what is wrong and what is right.
Yeah.
So I think
So-
here I would just like to add things. Sorry if I've butted in, Vandana. It's
No,
just
not
that
at all.
even during the COVID pandemic, when you have friends who keep saying, "Arey, vaccine to le liya, abhi to aaja," but you have to deal with the comfort zones. It doesn't
Bilkul.
mean by negating a invitation or declining an invitation you love that person less. Or so it's very important even for young people, young kids who probably are not vaccinated. It's very hard to say when friends invite over and the parents say don't go, or the child himself or herself doesn't want to go. You have to let the kid decide the comfortness. It doesn't mean he or she will be not accepted in the group, and that has to be inculcated by parents too. It's not that if you're going for all parties you'll be the most loved person.
Absolutely.
It's not that by not going for a party you'll be hated. And there are issues even amongst friends. Like for example, there are friends of mine who say, "Oh, you're comfortable going to this person's house but not comfortable coming to my house." So there are issues, and even at 50 plus people do feel that segregation. But a lot of things need to be considered: the vaccine status, the size of the house, the number of people, indoors or outdoors, whether you have somebody susceptible at home, whether you have an elderly. So multiple things go into this. It's safe to meet double vaccinated people in small groups, in two or three, with masks, in a well ventilated place, as far as you don't remove your mask to eat chai and drink, or drink chai or eat anything. Just see the, I know it's very therapeutic to see people in flesh and bones, but keep them at a distance in a well ventilated room. See to it that they're double vaccinated, and best to maintain that COVID appropriate behavior, because one really knows only 1 year old information. I know there is a lot of information, but we still aren't wise time wise. In 10 years' time, we can say, "Oh, probably one, two, three things we did, we need not do now." But it's too early to put our guards down. It's too early to put our guards down. So, yes, we need to be responsible, use our freedom responsibly. At the same time, we also need not unnecessarily panic. So, I think a lot of this, if patients and doctors, unfortunately when it comes to doctors, they are themselves ordering the CT scan, they are themselves giving the steroids at home. And I have had prescriptions where they're saying, "Oh, COVID positive, start aspirin in the house." There is just no logic to start these blood thinners. So this also is sad. Yes, you need to meet the right set of doctors, which is also far and few between. You need those right set of doctors need to learn to talk properly. Because even I have realized, even if you reply to a message promptly in the 10-minute zone, there's such a big relief. You can feel the relief in the next message that comes from the patient saying, "Thank you, doctor. And I have just said yes or no. I've not even wasted my time." So it's not that being there for the patient is a waste of time. So, like I say, every morning I joke to my sister and niece in Melbourne saying, from 9 to 11, I do my morning rounds, because all my COVID positive patients, I'm getting reports of what has happened: fever, temperature, oxygen, this. And all I need to do is keep up the good work. What is your plan for the day? And it's enough for them to cheer them up for the next 6 or 8 hours. And it's not much.
So I'm going to go back to Vandana and say that, like there is, yes. So I think, Rajam, one of the other things that I feel, and Vandana, I would like you to comment on this, is we place such an inordinate amount of pressure on our very precious doctors. It's unfair. And I know Rajam will never say this, but I will say this on her behalf because I care for her and I think she is very precious and she is very important for the world. She's had to do things that are unfair for a doctor to do. So I think as caregivers and as well-wishers, sometimes we have to take a call as to what is it that we are going to the doctor for. And Vandana, I would like for you to help us make that distinction, that what do we go to the doctor for and what do we go to the counselor for, so that a common citizen understands that well.
So thank you for that question, Bhavna. It's very important for patients to understand that not everybody's like all doctors are like Dr. Rajam.
That is true.
Yeah. So as you know that I am, associated with a cancer NGO group with cancer. And in my experience working with palliative patients, I've realized having a counselor along with the treating doctor reduces the workload on not the workload as in, the medicine part the doctor takes care of, but the emotional aspect can be balanced by getting a counselor on board. So here again, I will cite from an example. One of my very dear friends, the entire family got COVID positive. So instead of running to the doctor, she reached out to me. We had conversations, we kind of helped her settle down. Because of my experience working with COVID patients, I could direct her, while I could calm her, I could direct her at the right time to go see the pulmonologist, get her mother-in-law, admitted. The daughter had very high fever. She kept texting me. I said, it is okay. Kids do get high fever, but eventually they do settle down. And within a day that happened. So had there not been my intervention, probably she would have panicked and reached out for a doctor. And in the present circumstances, all doctors are not easily available. They are hard pressed. They themselves are exhausted. And I want to emphasize here, for all the goodness that they have, you can't expect the doctor to be at your beck and call always. So it is good. It is beneficial if it is divided and it is balanced by having a doctor and counselor on. So that's my perspective towards it, Bhavna. And I think that is good in totality for everybody involved, including the caregivers, the patient, the doctor, and the counselor.
Yeah, I think being mindful is absolutely essential. Just give me a minute, Rajam, I'll come to you. So I think as patients and as caregivers, it is important. And one thing that I'd like to highlight is that we are a team. How can we see all of us like a team? So it isn't siloed and specialized work. So it isn't like go to the doctor for this and the counselor for this and the caregiver for this and the patient for this. It is that we are a team, we share the information together, though one person takes the lead on one aspect of the healing and cure, but everybody is involved. So we agree that on the medical advice, the doctor is taking the lead, all of us are on the same page. On the other support system, the clarity of mental health, etc., the counselor takes the lead, but that doesn't mean that the doctor is not involved in it, and so on and so forth. You treat not just this unit as a team, but sometimes even the extended friends and family. So how do you take everybody along can become a very important part of how you navigate a difficult illness. I do have a few questions of people who had signed in. Rajam, did you want to say something while I bring
just
up the
want to say
questions?
this, that is the beauty where palliative care works as a multidisciplinary team. And I think the doctor, therefore, is tuned to realize that this is more like something that the counselor needs to sort out. And the
Yeah.
counselor realizes that this is where the doctor needs to come in. So I think that helps. But personally, what I have realized is from many patients who we advise counseling, It is not. So, for example, what I can say is, suppose I give a drug to a patient, the patient is happy to pop that pill in. But suppose I tell the patient it's important, I think you really need to talk to somebody. It's not something that patients lap it up. This is my experience, whether it is a chronic illness or whether it is a COVID acute illness. So in COVID, the difference is it's too soon, it's too acute, it's too much for them to handle. But even in a chronic illness, they don't lap up to counseling that easily. As much as you say, okay, I'm giving you two new medications, let's try that, it's easier for them to take it. At this juncture, Bhavna, with your permission, because I'm just very new in palliative care, I really would want to take Dr. Nagesh's comments on how easy is it for patients to say, okay, doctor, I will go for counseling because you're saying so. I have found that it is difficult. And I have found that I have to keep nudging, saying, look, I'm happy to hear you out, but I cannot give you back professional coping skills. I can be your soundboard, but I cannot tell you what to do.
Yeah.
And that's when they realize, ki, okay, yeah, fine. I mean, it's not that I cannot be everybody. So
Uh,
yeah, sir.
no, okay. Thank you, Rajam, for asking me to speak. I agree with you 100%. In fact, it's kind of funny. A very close friend of mine, her father went through COVID, and then in that process lost his mother too. And then he spoke to his daughter for the first time, sharing that I'm a little worried, and he was the only child and all that stuff. So she probably got in touch with me, and I said, hey, you know what, this person is available. Would you, talk to your dad, and would you be willing to talk? And then she messaged me, saying that I spoke to my dad, and he said, I'm fine right now. I don't have to bother about it. So I think that is the issue of people willing to, their willingness to talk, because there's some sort of a feeling that if I were to talk to a counselor or talk to a psychiatrist, then there's that, I'm crazy, there's something wrong with me. I always tell people that you should talk to counselors or psychiatrists so that you do not get crazy. It's a sort of a preventive thing. And I think that is really very, very true. And all the stuff that you people have been discussing, yes, we are talking about COVID because it's staring at us, right in front. The uncertainties are terrible. And more importantly, we really don't know what we are dealing with. Okay. But I think all this is very true in terms of any illness. Yeah. And the bottom line, because of course, Rajam, some of them, others may know, that I've gone through a lot of medical problems, 3 kidney transplants and so on and so forth. And the worst thing that can happen to anybody is the uncertainty.
Yeah.
The third transplant, which really succeeded in the end, the sign of a transplant being successful is that in the first 24 to 48 hours, the patient will be passing 25 liters of urine per day. And all that I did was to stare at my Eurosac bag, and the scene of the bag getting filled with urine and the nurse having to empty it so frequently was an indication that I'm well, you see. So there are lots and lots of issues that are there, and I think it has to be teamwork. The doctor, of course, needs to learn communication skills. It can be otherwise pathetic. And the counselors, they need to. And also, let me tell you that not all counselors have the training to be dealing with these sort of situations.
That is true.
Okay. Everybody and his uncle calls himself or herself a counselor.
Absolutely.
And they can be judgmental. Yeah. Okay. They may have learned a lot of theory in their thing. But for this sort of counseling, okay. And finally, you must get Seema Rao on one of your webinars. She's working with us at Karnashaya right now. They have done some phenomenal work in KMC Manipal, and they're actually auditing that, how they are using virtuals is saying in order to counsel patients, and in order to get the family members of patients, and how they are able to connect the patient with the family. I think that is helping. We have been using that in Karnashaya also, in a way, and I think technology will be of a great help on that. So
Yeah.
thank you, Rajam, for having asked me that.
No, thank you very much. It's absolutely wonderful to have your perspective, and thank you for sharing it. I do think that to the point that people don't go to counseling easily. We have over the years learned that going to a doctor is something that we can do. We treat doctors like gods, and that is such a disservice to everybody, to yourself, the power that you hold, as well as the disproportionate expectation from the doctor themselves. I think it's unfair on both sides. That said, I think learning to provide emotional first aid is a life skill. Every one of us should know how to be emotionally present with another person, just as a friend, just as a colleague, just as a family member, to provide, to hold the space in a non judgmental fashion, be able to pick up signs of distress are skills that we need in addition to all your academic and technical qualifications or everything else that you need to know about investments and banking and everything else. I think learning the value of another human being and caring for another human being is a life skill.
Yeah, which is something missing because compassion and empathy seem to be not a core skill that doctors develop, at the end of MBBS. So, which is why we really need to focus on that. And I think a lot of this could have been better handled if doctors were compassionate and empathetic, because then
True.
you can expect the same compassion and empathy towards professionals, because we also have faced unnecessary beatings, unnecessary stigma during the pandemic when we were putting our lives at risk. People were saying, "Arey, beating up doctors, burning hospitals, etc." So I think you have to give to get back. So I think even we really need to change our profession also by having compassionate, empathetic doctors. And it's very important to realize the significance. What you're exactly saying is, if all of us in this world had that element of compassion, and not just doctors, I'm saying, but in this pandemic, I want to focus on that because our lives also would have been better. Burnout from physicians also would have been much less if we were kind to each other. Doctors being kind to each other is also very important. So I think everything makes up and everything adds up to it.
So,
Absolutely. I would like to
and
point out, in addition to burnout, I think something that impacts all of us is compassion fatigue. I know when I pick up the newspaper or I hear a news, my way of coping with it is to say, oh, okay. So what I do is I keep that news at a distance. And because that's my way of coping with it. And at some level, you might have heard of this. So those of you who are from Mumbai would have heard of this. Mumbai is a very resilient city. What does that mean? That means that Mumbai has actually faced so much that many of us have become numb. And many of us just know how to cope with it because we have just seen it all. So, one way of coping, and which can be seen as resilience, is basically being numb. Now, the fact is that healthcare practitioners and doctors who are seeing so much, and that's true actually for counselors as well, that they see so much that they actually have compassion fatigue. And for them to, be available 24/7, for example. Vandana, would you like to
yes.
tell us about the midnight calls you get?
So yes, and also just want to small takeaways from Dr. Nagesh and Dr. Rajam about counseling. In India, there's such a huge mental block against reaching out for counseling because mental health, anything to do with mental health, is still considered a stigma. So when for Dr. Anand Parihar from Cope with Cancer, when he urged me to start palliative counseling, patients they had inhibitions. They didn't want to reach out to me. And once the ice was broken, Bhavna, I have patients, palliative patients for the last 2 years, and they call me even when they fear something. So that is how much counseling helps. So it is very important to break that notion of that counseling is for mentally ill patient, or you are mad. I have actually had patients who've told me that my family thinks that if I reach out for counseling, I am mad. So that is very important. It's not being mad that you should reach out to a counselor. It is because you are facing an emotional turmoil inside of you, which a counselor is specialized, is equipped to help you with. So that is very important. And also another thing that I want to add here is a lot of people have this confusion about the role of a counselor. So through this platform, I want to clarify that a counselor is to provide you with emotional support, not medicine. See, again, because people are wary of going to a psychiatrist. They are wary of going to a psychiatrist. So why they don't reach out to a counselor is वो दवाई खिला देगा या वो दवाई खिला देगी जिससे हमारी mental faculties are going to get affected.
That's
right? So that is very important, that counselor is going to give you that just going to handhold you, going to give you a space to express yourself and equip you with certain skills without sermonizing, without dictating. So that is very, very important. And about the compassion fatigue, yes. So in the morning, I get called at 6:30 and I'm expected to pick them up. And at times I cannot. And at night, I have people at 10:30. But again, I realized that because a lot of my patients are palliative patients. So the other day, I got a call at 10:30. He's a bone, he has bone and brain metastasis. His body was covered with sores all over. He had nowhere to go to Bhavana. Yeah. He pinged me. He sent pictures. To see those pictures was painful for me. So imagine the pain he was going through. So I got him connected to the oncologist and the medication was provided. But at that moment, it left me drained because here's a young man who's going through so much intense pain. He wants to live for 20 years. Imagine he has a 6-year-old daughter. And that drains me sometimes because I've lost a lot of young patients to cancer and that is demanding on me. And at times I want to draw that line. Like today I got a call while I was making breakfast and I said, hold on, give me some space. I can't handle it. So yes, I think all healthcare professionals go through compassion fatigue. Yeah. And they also need to heal.
That's right. That's right. And we have spoken about it between Rajam, Vandana, and as Caregiver Saathi, we will be offering a platform for healthcare practitioners and all health aid providers because of the intensely challenging and emotionally draining circumstances that people are faced with. And they might not be able to access them right now because, there is an adrenaline rush or, you need to be in a state of trance. Sometimes, it's a very interesting example that just popped up in my head. Once I was doing some work with the pipe cleaners, and I said that they drink themselves silly before they go into the pipes because it numbs their senses and they are able to do the work. And I would reckon that analogy would apply to doctors today because if they have to go through 50, 60 patients and their families and just do it day on day on day, the only way to do it is to do it in a state of trance or a state of, that rush. And it will come back later. And we probably need to gear up for that whenever it does. And be that as it may, in this while, can we be compassionate? I wanted to share an example of, it happened in my home. My husband called, there was a state of panic for some family members. So he called a friend who's a doctor and promptly got into this whole thing about, bed, ilaj, village, everything. And I looked at him and said, "What's with you? Why haven't you checked with her? How is she?" And he realized and he checked with her. "So, how are you?" And it turns out the doctor he was talking to was COVID positive herself. And we forgot to check in on her and just jumped into the fact that she's an expert and started taking advice and help. I think a fundamental of compassion is to remember to be able to check in. I would like to pick up a couple of questions that we've had at the time of registration and some that are here. Rajam, would you like to talk to that question about being able to talk to different levels of education and literacy? What would your advice be for them?
So this is regarding COVID appropriate behavior, right? For
Yes, yes.
so I think again there's a lot on the news. So if people who are working in your house, the staff members, etc., are not compliant and they're kind of gallivanting everywhere or not wearing masks, it is important for you to sit down and talk to them. And if you can't, then you need to see to it that you connect them to a doctor of yours to see to it that this is really happening. And ideally speaking, see to it that your staff gets vaccinated on time, and see to it that when they even beyond all this also, if they are not listening to you, then you can actually have the right to tell them that, look, you're putting my life at risk, so I am not safe of bringing you home, and I might have to get somebody else. And that's the reason why we have realized a lot of people have switched on to wanting to get 24/7 domestic help, and suddenly that market seems to be opened up because people are scared of the part timers coming in and going out. So this is another reason saying that, look, there is a real genuine problem. The only way out now is probably to be careful, to not avoid crowded areas, wear masks, get vaccinated, because also there's a lot of vaccine hesitancy across the education. It's not only amongst the uneducated, it's even the ones who are educated who have vaccine hesitancy. So you really need to from time to time update them about the present situation, and you need to therefore say, look, I'm not safe, you're putting my life at risk, I cannot afford this, therefore I would appreciate you. It's not just for your life, it's also important for you to see to it that the very person who's paying you the salary is at risk. I can't afford that. So you really need to get your act together, or else there has to be another way out. So you tell me what your problem is. I think you really, sometimes there are people who say ye sab man gadan hai, kahan hai covid. There are people who actually tell that to you. Is it really true? So I
Yeah.
think you really need to sit and explore and talk to them. And this is probably a little too late. This should have happened last year when it was all new, that yes, we can't afford to do it, and getting out of the pandemic, the only way to survive and see the other end is to really be careful. Having said that, even that sometimes doesn't seem to work, but anyways, we need to do our best. Like I said, use the freedom responsibly.
Yeah. No, so there are comments like, the cook says that while cooking, I can't wear a mask, or that, there's so much heat, and that's true. For example, when I go for a walk, I don't, it's so hard to wear the mask because I get suffocated very easily, or I feel claustrophobic. And I can imagine someone who is doing this on an ongoing basis, but I'll take that word explore from what you just said. I think it is important to be able to create some kind of a joint exploration with the person. I'm reminded of what my 6-year-old daughter had once said. She said, "Mama, if I can't learn the way you are teaching me, will you teach me the way that I can learn?" So I think it's also true for people with different levels of literacy and education. We want to teach them in one way, but maybe we have the luxury of wanting to can be able to teach in other ways.
So just taking this hint of being claustrophobic, the cook not wanting to do, etc., we then be very sure that the cook is cooking in a well ventilated kitchen. The exhaust is blowing fully. What I have done is given them a set of cloth masks, because then it absorbs the sweat. And And I also now have started wearing one cloth mask before a disposable, because the disposable or the surgical mask, the fabric is so not absorbing that it really makes you sick because the sweat is dripping. So wear the cloth mask, wash it every day, and at least it absorbs the sweat. It's
Yeah.
like wearing cotton in Bombay. You can't think of wearing anything else but
Yeah.
cotton. So
Yeah.
wear the cotton cloth mask. And on top of that, you can wear another. So you're also double masked. And if you're doing high intensity, don't do it in the outdoors. Do it in the comfort of your house. Put the AC, you do your stationary cycle, you do your treadmill in the comfort of your house. If you're just getting out of the house for getting out and a fresh air, you can do this. So you don't do your brisk walking and your jogging outdoor because it's uncomfortable to do so with a mask.
Yeah.
There are also many YouTube links which actually do high impact walking while by watching. So you put it on and you can do a 40-minute walk in your house with full entertainment. So there are many such things that you can do. But once you go outside, you have to be masked, because especially elevators are one of the places which really does transmit the virus. So you
Yeah.
can't afford to step out of your house without a mask, even if it is an open air.
Okay. Noted. Duly noted.
Yes.
We will not make that mistake. Uh, Vandana, there is a difficult question, so it is pointed to you. What kind of questions can be put forth to caregivers of child patients to make them bring out their pain or areas of support that they want, but are shy or feel awkward to ask?
This is a difficult question, Bhavna, because a parent-child relationship is something that I actually can't explain in words. What a parent goes through mentally is something, as parents here, we would realize what they go through and maybe associate with their emotions. One thing that I want to say is parents need to know that they have to take care of themselves too. If their children are COVID positive and they have to be there 24/7 for their children, it is very important for parents to know to be able to take care of themselves. If they cannot, to reach out to specialists who are providing counseling for who are trained for children counseling. So at the moment, what we can do is through Caregiver Saathi, we can connect those parents to people who are providing counseling specifically for parents of children.
So basically, what you're saying is that while there is a compassion and care which each one of us needs to have, and it's a life skill, there are some areas that require expertise, and we must consult with experts on those areas. And I think that's good steer. The other question is, I have observed that caregivers tend to ignore their own needs during active caregiving, especially if the duration of illness is relatively short. How can they be encouraged, convinced to seek out professional help? Rajam.
So I think, like you said, I don't think anybody's trained to be a caregiver, or you anticipate the role of caregiving in future when everything is hunky dory. Just suddenly it takes a minute for your life to change. And I think in the initial phases, there's a lot of to do things. You
Hmm.
have to do a lot of things for arranging the home, arranging the finances, arranging the role that that person actually did in your house to fill that void, now that he's in the transition of becoming a patient. So there's a lot. I don't think counseling comes at all in the top 10 list then, because
Yeah.
there's so much to do at that time. There's a lot of things to fix, there's a lot of things to change, you have to adapt, it has to sink in your life. It's only when it becomes a chronic phase that then it has to also come from a professional. The doctor who's treating you needs to realize that the caregiver, the family caregiver, needs to be told that you need to look after yourself. And the best way to approach that is that I don't think your parent, your mother, or your father wants to put your life on hold because of his condition. He would hate
Hmm.
it that he's the reason for putting your life on hold, he or she.
Hmm.
And you'll appreciate that, because as a parent, all of you realize what you aspire for your children. You want them to get the best of best. It's not just what you didn't get. It's basically you want the child to get everything that he deserves and desires. So I think one way of approaching it, in the acute phase, it's probably not easy to get across. But once it becomes a bit subacute and chronic, you know this person is going to have a long haul. It has to be a professional advice. It does not sink in that easily until the doctor tells, hey, look after yourself, or the parent himself says. So in my case, it was my mom who said, you're acting like a complete ditwit. If at 85 your father will not be ill, when do you expect him to be unwell? And she also went ahead and said that both of us, me and your father, will not leave this world at the same time. One of us will be left behind. You jolly well get used to the fact that it is going to be a situation where one day it is going to be the reality. So get grip of it now. Talk to somebody professional so that you're better prepared. So my request through this forum is, when you have elderly parents, talk to them about what they would like and how they would like to be treated, because they haven't become 80 and 90 overnight. You have seen them growing old. Talk to them when they can talk back to you with complete competency and capacity. Get it, even if it is informal, get it from them how they would like to be treated. This morning I got to know that a very dear friend of mine, my hostel roommate, lost a father-in-law. And when I asked her what happened to him, she said, he was 93. He was not eating. He had some issues with swallowing. So he was in hospital for 1 month. We put a tube through his nose, and that also was irritating. So we did a peg and we shoved a tube on his stomach. I said, once you should have reached out to me. The day he put the tube into the stomach, the next day the 93-year-old man died. And all he has been saying for the past 3 years is, I want to die. I want to die. I want to die. And the point is, we conveniently ignore these very valuable inputs from our patients, from our parents, because we do not like to talk about death and dying. And that is one thing that the pandemic has changed, because I think death and dying has brought into sharp focus during the pandemic. So take this opportunity to talk to your seniors, because the probability of death is very high in them. Two, they're already thinking of dying. It is the manner that is scaring them. They're already thinking of death. So listen to them when they're opening their mouth. Do not say, please don't talk about it. I am stressed, long day at work. Say, I would like to talk about it. Please, let's talk about this, because it's a win-win situation for the parent, for the son who feels guilty, Arey, kuch nahi kiya father ke liye, and the doctor who's at the casualty, who wants to put your 95-year-old father on the ventilator. In these resourceful crunch of times of COVID, we do not want 95-year-olds to be on a ventilator, because we want to save 40-year-olds. So please talk to your families.
Okay, noted. The last whole week, my mother has been insistent that she gets her will right. Now, for the work that I do, we've had multiple conversations and we have said that, this is the right thing to do. We should write a will. So my mother also is able to, preface it and say, see, you did that webinar. In that you said you should write a will. So I'm writing a will. And I have to say, I have struggled through it. So despite knowing that this is the right thing to do and this must be done and everything, I struggle through it. There is something that gets triggered. So it's not an easy conversation. But it is a conversation worth having, because there is a deep sense of regret when you've not had that. So I noticed Vandana is shaking her head very vigorously. So I'm going to ask her a question.
So it's because I agree with whatever Dr. Rajam has said. Every bit of it.
And what about what I said?
No, you said is absolutely, I agree with it 120%.
Thank you. Okay, so how is caregiving during COVID different?
So again, this is a very, very important question. How is it different? I started with this, that caregiving in COVID is highly stressful because a caregiver, if there is a parent or a loved one who's unwell, being at home, the caregiver is 24/7 stuck with them. There is no outlet. They can't go out. Sometimes going to a grocery store is therapeutic for a caregiver, which is not happening in this game. So this is one point how it's difficult. Second is the uncertainty of when it is going to end. What if my loved one falls ill? What if they go to the hospital and they do not return? So this is again very different because in the non-pandemic times, if that's the right word to use, if your loved one was admitted, you could walk into a hospital and meet them.
Yeah.
Now you can't even meet your loved ones.
Yeah.
And God forbid if somebody's loved one does not make it back home, you are unable to say goodbyes. So these are small things that make caregiving in pandemic very, very different. Caregivers want to help, Bhavana. When I was admitted for COVID in the ICU, my family wanted to do a lot for me.
Yeah.
But I was, they were not able to because of the constraints. So caregiving is more stressful during pandemic times.
I want to just add one point. I think also the respite for caregivers, because we are all at home. I think going to work, you didn't know what happened from the 10 to 6 in the house. But now you know every minute of which the caretaker is doing what when mom is coughing, or where is the caretaker when mom is going to the toilet. So you have like become a bit
Hyper vigilant.
Correct. And I think you're remote controlling, you're there to, it's also making them under the lens. So it's a very difficult balance to do. So it's like things like mom says, see, I told you, she doesn't get up every time I cough, she doesn't do this, and it's like I have to discourage mom from complaining, at the same time see to it. So that also is a challenge. There's no respite for caregivers. And other thing I feel is, for the senior citizen who's not completely invalid or who's not completely bedridden, their life is also hampered. So it's affected all age groups, right from the newborn to, for little kids who are not able to go down to play, those parents are going bonkers. For adolescents who can't meet their partners or loved ones, or they are going bonkers. For kids with raging hormones, the parents are going mad. So it's difficult for everywhere. It's caregiving, which is, I think, the biggest has really become very stressful. And I think COVID families infected, it's a different stress, but the COVID has affected everybody. It's not spared anybody.
That's right. So in fact, sorry, Vandana.
So I was saying the housewives can't go for their who actually manage a lot of the caregiving work. They can't go for their kitty parties. They can't go for their shopping. They can't meet friends. So this is how they're stuck inside the house.
Yeah.
Is aggravating it's actually making the whole situation more complex.
Yeah, that's true. Rajam, the question from Zaver, who is a very special person for all of us. How can we get the hospital?
Yeah, I saw that. Speak to the family. So the point here, Zaver, is that I need to address this question differently. It depends on what the patient wants. So if the patient doesn't want to be intubated, is a different thing. I think that also needs to be communicated to the doctors in the ICU, and comfort care needs to be given to that patient. If the patient, and usually patients who are about to be intubated are so sick that they can hardly breathe and talk. So it's very difficult for even relatives to see that patient who is basically probably suffering like a fish out of water. And that for relatives to see is also very gut wrenching. So I am not sure whether it's the right time. So I think when you have a relative admitted or a loved one admitted in the ICU with the potential of a low oxygen, your conversations need to happen then.
Yeah.
Especially in the COVID situation, you need to ask the patient, you need to ask communicate the decision, and you then need to speak to your patient then, because just before intubation it might not be possible for that patient. It's too much for the patient emotionally, physically, to see his loved one through a screen. It's probably
Right.
not appropriate. And in an ICU, many patients can be in that situation at the same time. It's quite difficult for a doctor also to connect to that particular patient. It could happen at 2 a.m. in the morning when the relatives are sleeping. So it's not possible
I think this happened
always.
very early in the COVID time. So probably at that time, these video calls and things like that, that
No,
they
no, no.
were
I think the
allowing people.
COVID protocol, they've always had this, because WhatsApp calls and video calls were the only way to connect. And they were realizing that patients were a little more settled seeing their loved ones, even if they were not able to talk long sentences with all the beeps and the hustle bustle of an ICU or a ward. But I think the problem also is that it might not be physically possible for doctors to, switch gears like this.
I understand. I
It's very
understand.
difficult. Plus, if you are two doctors on duty, and there are four people, going off at the same time, it is impossible for the doctor to then think of this human angle, saying आप अपनी बेटे से बात करो, या it's not possible. For that we need somebody else, like a social worker or a volunteer in the ICU, which is
Yeah.
difficult, again, because of the stupid pandemic and the COVID, the way it's behaved.
Right.
So
I understand. I think in our case, he was not, his phone was taken away like 7 days before he went this bad, saying that he shouldn't talk and he should, he needs to rest. And so there was like no
So that
communication
attitude, I think,
happening.
has changed. Now patients are allowed to keep the phone, but they may be too tired to talk to you.
I think so.
So
Yeah.
Thank you, doctor.
Okay, so there are a couple of questions that are for me and I will answer them. First of all, the first question is, what is companionship? So the way that we look at Caregiver Saathi or companions of caregivers, we are saying that just like there is a caregiver for the patient, which is a family caregiver, it could also be a professional caregiver that you hire. Caregivers go through their own secondary trauma or trauma of providing care to their family member, especially when there is long-term care or a difficult illness like COVID. Caregivers also need caregivers. And the best caregiving to be given to caregivers is companionship. So that's the friendship. And that's what we mean by companionship. A companion is someone who can hold your hand and walk with you through the darkness. So it is not important that the person is able to show you the North Star or to tell you which steps to take, but it is that person who walks along with you through the jungle. It is that person who holds your hand. It is that person who encourages and supports you during your caregiving journey. And it is that person who probably says, okay, you know what? It might be hard for you. So let's find out where a professional is and we will together do this. So I will be with you when we speak to a counselor. I will be with you when you're talking to a doctor. I will be with you when you want to talk the living will with your parent, and so on and so forth. So that's the companionship that we are talking about. And I think each person should know or can benefit by becoming that companion to someone else. There is a question about how can I be a caregiver? So the way that we look at caregiver is there are many ways of being a caregiver. You are a family caregiver already. You could be a professional caregiver and you could be taking the role of a companion. We urge you to get in touch with us on our website, and we will be more than happy to provide you support. This particular webinar has gone way beyond our agreed time. And I am not surprised because all of us like to talk and all of us are talking about such an important topic. I know people are falling off because it is time as well. So I would encourage those who are here to fill the feedback form. And while they are filling the feedback form, closing remarks from Rajam and Vandana.
Is it okay if I go first, Vandana? So I think the take home message from this is always self-care is important. Start with yourself. Please look after yourself, not just physically, emotionally, psychologically, financially. And it's difficult to do socially now, but please remain emotionally connected to the friends and family that matter to you. COVID is very much there. It's not gone anywhere. It probably won't go anywhere. So we need to get vaccinated. We need to stay safe, and we need to do all the COVID appropriate behavior. Probably for the next 3-4 years till all the vaccines get streamlined, and then we need to be vaccinated every year as the flu vaccine, which changes the variants every year. And the last point is, when you get COVID, please try and do not panic. Try and get to a doctor. Do not self medicate. And please also don't go overboard by hoarding oxygen concentrators, BiPAPs, this, that, and the other, because we need it for people who are suffering outside. Keep your resources ready. Reach out to a doctor. Try not to panic. And only thing that we really help is stay safe. And please identify family members who you feel are becoming edgy, irritable, whether they're infected or affected by COVID. Try and talk to them. If you can't reach out, get professional help to talk to them, or friends, etc., so that we catch it early and give them the support they need. I think the only thing that will take us and we all can see the other side of the pandemic is to be there for each other, whether it's virtual, video, WhatsApp, whatever. Just be there for people. You don't have to say I told you so, or you don't have to give them 1 2 3 4 5. Just be there, and that, I think, will make a difference.
Thank you so much. Closing remarks, Vandana?
Yes, self-care is important. Self-preservation is important. Do not feel guilty about it. It is very, very important, because if the self is happy, if the self is stable, you can contribute to your loved ones and to the society as a much better person. So that's my close. So reach out for counseling. There is no stigma attached. Think of counseling as something that is going to empower you.
Yeah.
We do not advise, we do not write prescription. We will help empower you to take care of yourself. So those are that's all that
Thank you for that. Thank you for that. I think very well summarized. And I am very grateful to the two of you for your presence, for your friendship, for your companionship, for your care and concern, not just for your friends and family and patients, but also for me and for Caregiver Saathi. So thank you everyone for being here. Lots of love to each one of you. Let's hold hands and walk through this darkness. We will get to the other side. Have a lovely evening and a beautiful weekend. Thank you.
Thank you.
Thank you.